The emergency rooms and hospitals in general are beyond busy right now. If you have to go to the emergency room, even if it's not for the current pandemic reasons, do you know what to take with you to make your visit go as smoothly as possible? By the end of this video, you will have the information that you need to make your visit to the emergency room as stress-free as it can be. By subscribing to my channel and hitting that little bell, you'll be notified every Monday when I post a new video that's designed to help you and your parents navigate the sometimes confusing healthcare system. Good morning, health-minded people. I'm Dr. Snow, and I have over 30 years of experience as a pharmacist, both in the hospital setting and in the retail setting. But I've never seen anything like this. No one has. Our healthcare system has been stretched beyond its limits. And first of all, I'd like to say thank you to all the healthcare workers out there that put their lives on the line each and every day to take care of our sick and injured. If you have to go to the emergency room for whatever reason, you can almost bet it's going to be a horrendous experience. The ERs are overrun with sick and injured patients, and while big city ERs have always been busy, the situation is just crazy right now. My colleagues that still work in hospitals are reporting that it is almost certain that you will not be allowed to go back with your loved one, even if it's your child. Once the patient is taken to an examination room, you will probably be asked to wait in your car in the parking lot until someone can call you with an update. In order to expedite the visit and provide the medical staff with all the information that they need, it has been suggested that everyone fill out a medical history page prior to needing it so that you can take this with you to the emergency room. This history should include the patient's full name, birth date, address, and phone number. An emergency contact should also be provided with the name of the emergency contact person and their phone number, especially if this is for a child. It should also include the family physician and their phone number. All medication and food allergies should be listed, including the reactions if known. Are you allergic to the dyes that they use in imaging tests? These are called IVP dyes, and it's important that you list that on your medical record. List all of your medical conditions such as diabetes, heart disease, or high blood pressure. Do you have a cochlear implant and you cannot receive an MRI? It's important to make sure that this is on the document. If you are deaf or blind, this needs to be on the medical record. Also include your medications, the names of the medication, the dosage of the medication, and how frequently you take it. Include any recent illnesses or surgeries that you've had. Also include a copy of your insurance card so that you don't have to dig it out at the last minute. Have you ever thought to fill out a medical history to carry with you in case something happens and you can't communicate with the medical staff? Comment below if you've already done this. The medical history should be a one-page document. Don't overwhelm them with details, especially if you had a tonsillectomy when you were 10 years old and now you're 50. You should carry a copy with you at all times, whether we're in the midst of a pandemic or not. Keep a couple of copies of each history for each family member in a folder, and make sure that you have a folder in each vehicle you own. Keep a few copies at home and take a copy with you to each doctor's appointment so that they can put a copy in your chart. Make sure that you keep up to date on any changes in your status since your last visit. Also, give a copy to your healthcare power of attorney agent. If you don't have a healthcare power of attorney agent, why not? Watch this video to find out why it's so important that you have a healthcare power of attorney agent. This is a horrible time to visit the emergency room, and I hope and pray that you don't have to go. However, if you do have to go to the emergency room, please remember to be kind to those that are trying to help you. These people are literally putting their lives on the line by just going to work. As of April the 5th, 2020, over 100 healthcare workers have died of COVID-19. These people are heroes. Be kind. I have created a fill-in-the-blank medical history form that you can download and print out as many copies as you need. I hope you will never need it, but it's important to have one. It's completely free. You don't even have to give me your email address. Just download the form and fill out one for every member of your family. If you have found this information helpful, please fill out a medical history form today and carry it with you wherever you go. Then consider pressing that like button and subscribing to my channel if you want more information on how to navigate the healthcare system. So, are you going to fill out your medical history form for everyone in your family today? If so, type history in the comments below. Thank you for joining me today to learn how carrying a medical history form can make your emergency room visit go a tiny bit smoother in 2020. Stay healthy, wash your hands, and have a blessed week.